Laurie and her sister grew up knowing that there was cancer on their father's side of the family.
Growing up, we knew that 2 aunts had passed away from cancer. We had one aunt who died of breast cancer and another who had breast cancer and survived for 15 years, but later was struck by ovarian cancer. So we knew we had that in the family history.
So their father had the test and found out he was positive for a mutation.
I guess we don't hear as much about men carrying the breast cancer gene, and he came back positive. So that made us all aware that us 4 daughters were susceptible to be positive or negative for the BRCA1 and 2.
I said to my dad, there are great things you gave us, and there are things that aren't so great. But what are you going to do? You know, that's a reality. That's life. I think he felt a little guilty. But, you know, at least, you know, I'm so proud of my dad that he got tested, and that he could give that information to us so we could get tested. If he had refused or didn't want to deal with it, we might have all backed away from the whole issue, and then we wouldn't know.
Now, once that mutation was identified, both Laurie and her sister were able to be tested.
It was a no-brainer for me. For me, I didn't worry about breast or ovarian cancer. I never thought about getting cancer. I was in my early 20s. But when I was given the information that there is a gene, that we might have the gene, I said, I need to know as soon as possible whether I have that gene so I can perhaps take action or at least be a little more cautious and aware. The more information I could know about my own body, the better.
Most cancers occur sporadically or simply by chance. But in some families, we see more cancer than seems normal. So finding which of these families have cancer related to an inherited mutation is important because cancer risks for those of us in hereditary cancer families are much higher than in the general population. Those of us with an alteration or mutation in either the BRCA1 or BRCA2 gene face a much higher risk of developing breast and ovarian cancer. In addition, we are much more likely to develop it earlier in life, before we turn 50. Also, our risk of developing a second cancer is increased.
I had known that my father's mother, my paternal grandmother, had had breast cancer, but she didn't actually die of breast cancer. So it wasn't something that just rang in my head throughout my childhood that, oh, I have this family history of breast cancer. It turns out that I do have a family history of breast cancer once we looked into it, but it didn't really, you know, come into my life until my sister was diagnosed.
After her initial diagnosis, Lisa's sister was tested for the BRCA1 and BRCA2 genes and found out that she was indeed a mutation carrier.
And when that test came out positive, now all of a sudden it was impacting me. I then had to say, okay, do I get tested? Because doctors were telling me I had a 50% chance of possibly carrying that gene as well. So it was a difficult decision, and one I wasn't really ready to do immediately, but then, you know, I had to be faced with the reality that I've got a family, I've got children, I can't just turn away from the fact that I could possibly have this gene.
So Lisa contacted her doctor, and together they went over their family's history and talked about the benefits and limitations of genetic testing. Lisa and her doctor discussed the information she could get from the test and the options that would be available to her depending on her results.
She was very supportive, very informative, really just laid out the different scenarios, the different options.
Once Lisa made the decision to go ahead with testing, she signed a consent form and gave a small sample of blood. The confidential results of her test were available within a few weeks.
The actual testing process is nothing. You just get a blood test. It takes a minute, and that's that. And then you wait and you get your results.
There are 3 types of tests for BRCA1 and BRCA2 mutations. A comprehensive BRCA analysis examines the entire BRCA1 and BRCA2 genes, looking for mutations that could increase your risk of inherited cancer. This is the test most people would have if no one else in their family has been tested yet, like Lisa's sister had after her breast cancer diagnosis. A single-site BRCA test looks for a specific mutation that has been previously identified in your family. So if you have a relative with a BRCA1 or BRCA2 mutation, you would have single-site testing to see if you inherited the same mutation. And a multi-site 3 BRCA test is for individuals of Ashkenazi, Eastern European Jewish ancestry and is designed to find the 3 most common BRCA1 and BRCA2 mutations found in this population. If you take one of these tests and the result is positive, you'll know you have HBOC syndrome and are at increased risk of certain cancers. When Laurie's test came back positive, she was still quite young and thought she had time before she had to think about anything beyond increased surveillance. The diagnosis did, however, prompt her to move forward with her life more quickly, getting married and having a baby earlier than planned.
We decided to get pregnant as quickly as possible. And if I didn't know I had the breast cancer gene, I could be sitting here right now talking to you and not have a beautiful little 3-year-old girl.
8 months after her daughter was born, Laurie discovered a lump in her breast, and armed with the knowledge of her cancer gene, she took aggressive action.
I went to the doctor and I said, I feel something strange here. Now the doctor said it's probably nothing, it's probably a complication from a blocked milk duct or something like that from breastfeeding. And I said, look, I'm really concerned here because I'm feeling something and I've got this gene and I need to at least check it out. And so the doctor did a biopsy, and a few days later, I was in the middle of work and I got a call on my cell phone and the doctor said, you've got breast cancer.